Welcome to the Stress to Success Shift podcast and Dr.
The
Dan.
Destination Health podcast in combination with each other today.
And we've been having a lot of fun with this week. These are special edition podcasts. I don't know. We're having so much fun. We might have to make these like an ongoing thing. Dr. Dan has his amazing podcast, and we seem to come at things from different angles, and yet many of our guests are the same, and our current guest is no exception. Dr. Achina Stein is a functional psychiatrist. She is the Amazon international best-selling author of What If It's Not Depression? Your Guide to Finding Answers and Solutions. She is a board-certified psychiatrist and has been in practice for 25 plus years. I don't see how. She looks too young. Propelled by her son's mental health crisis in 2010, she found functional medicine, which resolved all of his mental health problems as well as her own. She has a busy private practice called Functional Mind, LLC, in Riverside, Rhode Island, where she sees patients for functional medicine and psychotherapy. She is a certified practitioner of the Institute for Functional Medicine, a distinguished fellow of the American Psychiatric Association, an Azarius energy healer, and was awarded the Exemplary Psychiatrist Award by, I'm just going to spell this out, NAMI-RI, I assume that's Rhode Island, in 2008. She is a former clinical assistant professor of psychiatry and human behavior of the Warren Alpert Medical School of Brown University. And as a companion to her book, she offers programs to find and reverse all the root causes of your depression-like symptoms. So thank you so much for being here, Dr. Achina. And I know that you have been a regular on Dr. Dan's podcast. And so when we were discussing how to fit all of this into your busy schedule, we just decided that we would experiment and have fun and do this as a combination podcast. And you are also, and I feel so honored to say this, you are one of the world-class experts in the Brain Reboot Summit series. And I'm honored to be a part of that panel as well. And so we have one coming up in a few days. It's Saturday, April 23rd at noon Eastern time. And I know that you have a really, really great topic that is called Reverse Depression with Food and Digestion. What an amazing topic. And one that most people, unless they've happened to have met you, listened to a podcast, read your book, it's like most people don't connect food and depression. So I'd really love for you to start by talking about going back a bit and saying why you got into that. In your bio, I talked about your son. Can you give us some background on why you started making that connection?
Sure. Yeah, absolutely. So my son, and I just want to say thank you for that introduction, and so that people understand that it's NAMI, Rhode Island. NAMI is the National Alliance for Mental Illness, and the Rhode Island division of NAMI. It's a national organization. So just wanted to mention that because I think you had some difficulty with understanding what that was.
Yeah, NAMI, NAMI. What is NAMI? National Association for Mental
illness.
Mental illness. There you go.
That's correct. Yeah. And May is Mental Health Month. So and NAMI actually does a lot of events for education about mental illness. And I am going to have lots of tips on my Instagram and Facebook page for Mental Health Month. So stay tuned.
I love it because April is Stress Awareness Month. Right? So this is perfect. We're like on the cusp of both, right?
Yes, that's why we're back to, we're this duo here. That's great.
Yes.
Trio. Yeah, trio.
I'm back. I got knocked off there for a second. I don't know.
I know. I saw that. Good to see you back.
Thank you
We're just
for
not
having me.
allowing anyone from New Jersey on this podcast today, Dr. Dan.
Well, that knocks Dr. Achina and I out. So we'll see you later.
So to answer your question, so, I was a traditional psychiatrist, doing my thing, seeing patients back to back, not 15 minutes, but 25-minute sessions and prescribing lots of medications. And my son had a serious mental health crisis where he became acutely depressed and was standing on a ledge 5 floors up, ready to jump. And this is something that really shocked me because I didn't see it coming. And it was really just after a tiff with his brother. And when I, obviously I did the right thing in terms of getting him to a psychiatrist, making sure he's safe. And he was put on 3 to 4 medications in order to stabilize him, but he was no longer my son. And the question always came up for me is like, well, why did this happen? Why did this happen? Why didn't I see it coming? And long story short, it was something that was being driven by his body, particularly in his gut, that was affecting his brain. And there's lots of research now that shows that inflammation is a major root cause of depression. For many years, it was thought to be a chemical imbalance, which has been disproven many years ago, actually, but people still believe that. And it's really multiple root causes. And those root causes are food, infections, toxins, stress, all of which affect your hormones, particularly your stress hormones. So I really focused my talk on food and digestion because you can actually make your own neurotransmitters by food. Food is a major source of amino acids specifically, and serotonin, norepinephrine, epinephrine, and dopamine are made from amino acids. And so if you are eating the appropriate foods and digesting them, then you're providing the raw materials for your gut to be able to assemble, just like factory, your microbiome or your factory workers, and assemble those neurotransmitters and, sort of put that up to your brain, And so I think it's really important for people to understand that because they have some control over this. They have some control. And so what I do in my talk is really break down all the pieces, that need to be in place for the neurotransmitters to be delivered to your brain from the very beginning. Just like, I always I've actually talked about this on other podcasts, is that, everybody has experienced, I think, maybe in Canada as well, experienced not having toilet paper, right? During the pandemic, right? Where was the breakdown, right? Where was the breakdown?
She had to go there.
I bought it all up. That's why there was no toilet paper.
So, right. I mean, so it's you have to think about, well, why did that happen? Because we're so used to it just being there, right? It's always on the shelf. It's always on the shelf, thousands of choices. And then suddenly there's no toilet paper, right? But why? So, the same thing happens in our bodies. So I use real world examples because it's exactly the same on a microcosm level. What's happening outside of us in terms of systems and how they break down, it's the same thing in our bodies, same thing. So I think when people start putting that together and realizing, oh, I'm eating tons of junk food. Oh, I'm not chewing my food. Oh, I'm in so much stress that my gut shut down. Oh, I have a gut infection. Like, do you see all those root causes, right? Can lead to depression. So, we're going to focus on food and digestion, and that's just the tip of the iceberg.
I find this fascinating because I live in the gut. That's where my practice is. And I look at it from many different aspects. And I'm getting a lot of patients in, it's talking about the pandemic, coming out of the pandemic, and they're more stressed and they have more mental health issues. Do you see that also in your practice, Dr. Achina?
Oh, absolutely.
Yeah.
Absolutely. Yeah. Stress is a huge factor, and it's the gut brain connection, right?
Right. Sure.
Tons of research that shows that the gut is connected to the brain, and stress is a major driver in many ways, that can cause stress, but also be disrupted by stress as well.
That whole concept of that leaky gut, from the stress, the foods, the toxins, inflammation caused by food sensitivities, can create a whole host of problems, one of which is mental health issues. And you're working directly on the gut by putting good foods into your system, staying away from those processed foods, because not only was the toilet paper flying off the shelves, Dr. Achina, right? It was also the processed foods. It was the cakes, the candies, the sugars, those ultra processed types of foods that are out there. You need to stay away from those, correct?
Absolutely. Yeah. People start really craving carbs. I was going to say, I did say craving carbs, and when they're under stress, and and then it can become an addiction for some people, which then causes a whole host of problems, hyperglycemia, hypoglycemia, which then can affect your mood. But it can put on a great deal of weight, which then can affect your mood, right? So it's a short-term answer. Sometimes you do need to eat some carbs in order to get through the day or a couple of hours. It's a great way to address acute issues, but when it becomes a chronic way of dealing with stress, that can become very problematic. So it's best to look for combinations of fat and protein together.
Right. The one thing that you had said before, and I'm definitely not a psychiatrist. You said you didn't see it coming, and I hear that a lot, right? What does that mean? What does that look like? You didn't see it coming.
Right. I mean, here I am. I'm a psychiatrist, so if anybody should see it coming, it should be me.
Right. 100%.
Right. So, all adolescents have moodiness, right? All adolescents are, and that's just part of being an adolescent. They are, sort of swinging from, being in the family and part of the nest to flying as an individual and being more adult. And so it's just like a young child moving away from mommy to the sandbox and getting a little frightened, coming back to her side. And so that transition, is really part of normal development. And it's going to cause some feelings, right? And plus, then there's also the issues of making friends and feeling accepted. And so all of those things were happening for him, and they were in the range of normal for me in my assessment of things. And, sure, occasionally he came home one time in 5th grade crying that he had no friends. What parent doesn't have that occasional?
We all have that.
Right.
I mean, all three of us and everybody that's listening today has said, has heard that from a child, and you look at them and you say, huh? Because you do have friends, right? But that's a feeling and emotion. You want to kind of validate that,
Exactly. So, my husband and I mean, I consider us really good parents. We had, two other children who were, fine. They all got along. I mentioned that he had a tiff with his brother, but it was like over a board game, like it was typical sibling kind of stuff. So there was nothing there that was indicative of these are things like, oh my gosh, this is not good. Like, we have to watch this. It was never anything like that. Never, so the kinds of, so when he had this acute depression and we really looked for the why, I had him see a functional medicine doctor. And that was my first introduction to functional medicine. And we found that he had celiac disease. Like, who knew, and then when you search for your family history, well, guess what? His maternal grandmother's sister has celiac disease. Okay. And then when we did testing, I had a gene and my husband had a gene. And most likely my husband's mother has celiac disease, but she refuses to look at it, but she has serious gut issues.
Right.
She doesn't want to give up her donuts. So she puts her head into the sand. So, and
give up your donuts, everybody. I gave them up. It's really important that you give them up.
Yeah. So and so he was also nutritionally deficient because all he ate was white food. He had issues with texture and color and didn't eat vegetables except for broccoli. And that was the only vegetable he would eat. He would eat tons of pasta, corn, popcorn, it was tortilla chips. It was so hard to get vegetables in him. So he was nutritionally deficient. And and he had inflammation in his body, signs of inflammation that I never connected to potentially causing depression, like eczema, severe eczema to the point of looking like he was part dinosaur, and because he loved dinosaurs, and so we would sort of say, "Oh, you're part dinosaur," and because they were so wrinkly from eczema, and he had severe constipation since the age of 1. And, so when you look back in hindsight, that was probably the gluten, and he was also found with food sensitivity testing that he had problems with dairy and soy. So when we pulled all 3 out, his mood got significantly better. Well, I should say, let me backtrack. His constipation and his eczema got significantly better within a couple months. His mood got better within the year, and he was able to come off of the 4 medications that I mentioned.
That's awesome.
Yeah, it was. And the thing that got me on that track, and I've said this in other podcasts, is that he had double vision. And that was the one symptom. And this was after this acute issue, of acute depression. He also had double vision. And that's what made me think there's got to be something else going on. I always wondered to this day, if that physical symptom wasn't there, would I ever have gone down this road of functional medicine? Because then I would have just attributed it, oh, this is just family history, it's bound to happen to one of my kids. Oh, well, it happened to be him, like that kind. Thank God there's that, because I thought there's got to be something neurological going on. Because at that time, I was still a very traditional doctor. And now I look at all physical symptoms as being clues for toxicity and inflammation. And when you see clusters of symptoms in a certain way, it really helps you to know, oh, this is the root cause. So if you have metabolic syndrome and you're overweight and you're, it's usually cardiovascular, and the root cause has to do with insulin resistance. And there's different things. If you have an autoimmune, if you already have antibodies, to some part of your body, whatever tissue it is, then there's probably a chronic infection, and you got to get gluten out. And that's the root cause of depression, having that inflammation from an autoimmune type of driver. So there's different drivers, and sometimes you can have multiple drivers when it comes to depression. So depression is just a symptom, not a disease, not a disorder, in my opinion. That doesn't mean you can't have it to the degree of it having a major depressive disorder. What people don't realize is that all the diagnoses in the DSM-5 is clusters of symptoms put together to create a disorder. It says absolutely nothing about cause. Nothing about cause. It only says you have these symptoms. They come together for a period of time to this severity, to the point that you can't function, and you're in severe distress, and therefore you are stamped with this diagnosis. And all of these studies have been done to show that this medication improves this disorder by X amount. And so the benefits outweigh the risks. And so take it. Right.
Yeah. Yeah. You make a really great point. I want to back up and highlight something that you said. And because I know as a doctor, when something has gone wrong with my sons or my family, there's a tendency we doctors have of beating ourselves up. Like, why didn't we see it? Right. And why didn't we know? Why didn't we catch it? And a lot of it is to blame from our medical training. Like, I know there's like a textbook, and I'm sure Dr. Dan even looked at the same textbook, the Robbins pathology. And there's like that one chart in there that talks about the classes of inflammation, right? That every medical student has to memorize word for word for word. And inflammation is just simply a dysfunction, a derangement of the immune system, where the immune system goes haywire. And so class 1 is IgE, it's like allergies, class 2 is sensitivities, right? Celiac fits in here. Then you get like class 3, class 4, where it's the eczema, it's rheumatoid arthritis, it's multiple sclerosis. So in the brain, it's so many different, and I'm not here to name all of them. Right. The point that I want to make is that we all have to memorize that. We know that the root cause is inflammation and a derangement of the immune system. And yet when I asked my professors in medical school, well, why is it that when somebody has Hashimoto's hypothyroidism, which is autoimmune condition, which is part of this inflammation, you treat that, and then you treat when they develop rheumatoid arthritis, you treat that, and then when they develop multiple sclerosis, you treat that, and they were just like there's a total disconnect.
I agree.
Between understanding
right.
that these are all caused by inflammation.
Right.
They're not a cause, as you said, in and of themselves, and then they're like, well,
disorders.
No, that's and they know. And we learned that when you have one autoimmune condition or inflammation cause condition, you're going to have more. You are prone to more. In fact, like when they look at asthma, they even ask, is there a history of eczema? Right? So they know an allergy. So they know that they co-occur together. And then the disconnect happens. And even my professors were like, well, no, it's just the way we do things. We wait until somebody gets Hashimoto's, and then we give them thyroid medication. And then we wait until they get this other.
Right.
Right.
And the antibodies are ignored if it's noted at some point. For me, my antibodies were noted when I was in medical school. And I didn't have a thyroid storm until many years later, and after my third child. So, and that kind of prevented me from having a fourth child. And I absolutely have been, upset about that. Like, had someone told me that I needed to heal my gut and remove gluten at the time when they noticed my antibodies at the time. And, so, I mean, it's not something that they knew then, but I wish someone told me that, because maybe I'd have a fourth child by now, So I think it's really important for people to understand that there's consequences for not acting on that data, and that it would be a good prevention to get an antibody panel. There are companies where you can do that, especially if you have a family history of autoimmune disease, which I do. My mother had rheumatoid arthritis. My son has celiac. I had a cousin who has ulcerative colitis. It's amazing how much history I have. Gosh, wouldn't it have been nice to be told, like, why don't we get an autoimmune panel to see if you have any antibodies, and then we can get, so it doesn't become a full-blown autoimmune disease, right? That's what's really important, is to prevent these things, and that we have the tools and the ability to do this. Unfortunately, there's two worlds here, the traditional world and the functional medicine world. And fortunately, these worlds are coming together. There is some overlap, slowly but surely. In the time that I've been practicing functional medicine, I cannot tell you how many doctors refer patients to me, and they're not functional medicine doctors. They don't want to be functional medicine doctors, but they respect it enough to say, I can't help you, but I know somebody who can.
That's awesome.
And that's important. That's a very important thing, because I get the same thing, Dr. Achina. They would say to me, this week an endocrinologist referred me several patients related to the gut. And he said to me, I have no clue what you do. I don't know. You've explained it to me. Theoretically, I can understand that, but it doesn't compute. Everybody's trained differently, but that's okay. There is a marriage that is becoming with traditional and functional, and it's going to be very exciting in the future to serve humankind and to help out people such as yourself, myself, Dr. Irene, because we all went through something that brought us to this point in time. And that's important. There's always hope when it comes to this. There's always hope.
Yes, absolutely. 100%. Yeah,
absolutely. Absolutely. This has been amazing. Really, really looking forward to hearing your talk, especially on Saturday, April 23rd for the Brain Reboot Summit. The Brain Reboot Summit goes from 12 to 3 p.m. Eastern. And you are one of the amazing speakers. I'm honored to be there as well. And please sign up. It's free. And even if you can't make it, register, because we're doing an encore weekend the following weekend where you can binge watch all 3 hours and learn so much. And you're going to get actionable, practical tools and resources that you can take away. Right, Dr. Achina?
Absolutely. 100%. Each one of our speakers will be giving you actionable steps, and we're all going to address different drivers of what can cause inflammation in your brain.
Absolutely.
And it's, what is it? brainreboot2020.com, which will be in the show notes. Now, I'm not speaking at
Okay.
the summit,
Okay.
but
I have to interrupt. Brain Reboot 2022.
2022. I'm sorry. I have
We're
it
in
2022.
Yes,
Yeah.
you're back in the pandemic warp.
Brain fog from the pandemic. Now, I'm not speaking, but I am going to be there, and I'm looking forward. I'm asking questions that day. So everybody who's listening in right now, join in. Brain Reboot, don't laugh at me, 2022.com.
Yes, it'll be in the show notes. It'll be in all of our.
It was a good pickup by the boat, so that's all good.
Yeah, we want everyone to show up to the right place, and so we'll welcome everyone and look forward to your questions on Saturday. Looking forward to hearing Dr. Dan's hard questions that he's going to ask us. So he's going to draw the best of the best out of everyone. Always. And we'll look forward to all of you on Saturday.
Absolutely. Great.
Thank you very much, Dr. Achina, for coming on.
Oh,
always a pleasure.
Thank you, Dr.
Thank you
Achina.
for having me. It was so much fun. I love being on this show with you guys. You guys are a lot of fun.
Always good.
Thank you. Well, fun gets more done.
That's true.
Take care.